So in this segment, we're going to be talking about Test and Trace, not NHS Test and Trace, Serco, and other private companies, Deloitte and all that. Um, they've spent, they've got a budget of £37 billion, and apparently there's been no clear impact in terms of dealing with COVID. So I don't agree with all of the findings in this report. They did leave themselves open to a fair bit of criticism. However, wasted a lot of money on the system which didn't prevent the lockdowns, so it didn't work. It didn't prevent two out of the three lockdowns. We had the first one. It's not their fault. That's more on the government, if anything. But the last two is kind of on them for not dealing with the spread of COVID as well as they should have done. But then again, when you've got guys like Dishi Rishi, doing eat out to help out and all this stuff, who knows? So the impact of Test and Trace is still unclear, despite the UK government setting aside £37 billion for it over 2 years. MPs are warning. The Public Accounts Committee said it was set up on the basis it would prevent future lockdowns, but since its creation there have been two more. Especially the second one, I think, was probably the most embarrassing one. It said the spending was unimaginable and warned taxpayers could not be treated like ATM machines. But Transport Secretary Grant Shapps said the report defies logic. Again, we'll be talking about that because to an extent he is partially right. Baroness Dido Harding, head of the National Institute for Health and Protection, which runs the system, pointed out it had been built from scratch and was now doing more tests than any other comparable country. That's mainly because we're pushing a lot more tests, but the issue is the turnaround time isn't there. Doing a lot more tests is great, but if you can't return the test, within a day or two, it's not that effective, is it? Because those people go on to spread COVID a lot more. So, and the thing I would look at is how much has it cost other countries to do their test and trace systems. That would be an interesting thing the report, could have probably looked into. She said performance has been improving with more and more people being tested, positive being reached, and more of their close contacts being asked to isolate. I have also read stories about people being called multiple times by call centres saying that they've tested positive, they need to isolate, or they've come into contact with someone who's tested positive who need to isolate. Like, why is there no system to say, yes, this person's been called, they've been told they need to isolate, and then take them off the thing? The call list. I don't understand, but it is making a real impact in breaking chains of transmission. Baroness Dido Harding said, but she would say that, wouldn't she? So MPs report questioned an over reliance on consultants, them paying more than £6,000 a day, which is an obscene amount, especially given the situation with nurses and things like that, especially since the system hasn't actually done its job. A failure to be ready for the surge in demand for tests seen last September. That's a major failing. Never meeting its target to turn around tests done face to face within 24 hours. That's a big deal because if you get these tests back quickly and say, look, you've tested positive, stay isolated, that means that person's spread is far less than someone who's been told 2, 3, 4 days after they've tested positive that they need to stay at home. Never meeting its target, we mentioned that one. Contact tracers only having enough work to fill half their time, even when cases are rising. So it's basically saying that the people who are meant to, trace the contacts of, say, if I tested positive, you need to contact, the people I've been around for the last few days to, tell them that they've tested, that they need to self-isolate, and that these people were only given, only had enough work to fill half of their time, even though cases were rising. So these people weren't given the amount of work that that they should have been given, basically. A splurge on rapid tests with no clear evidence they will help. I did read one story today where some of these rapid tests, one of them said someone tested positive, but then they did the PCR test, which is apparently better, and then they tested negative, but they had to self-isolate for 10 days anyways, including their whole year group, because some of these tests are not the most reliable. The promise on which, committee chairwoman Meg Hiller said it was hard to point to a measurable difference the test and trace system has made. The promise on which this huge expense was justified, avoiding another lockdown, which has been broken twice, and obviously the costs that come associated with a lockdown as well. So Grant Shapps told BBC it was thanks to Test and Trace that the UK variants first identified in South Africa and Brazil had been limited to 285 and 6 cases respectively. The issue is, the person, they found 5 out of 6 people. Test and Trace, I think, found 5 out of the 6 people with the Brazil variant. Someone actually called NHS 111 and revealed that they were the person who didn't fill out the form properly. So, not the big victory that he's making out to be. Also, the fact is they let this thing in through the borders. So, is that a big win? I don't think so. I don't think so. What you've done is you've let the cases come into the country, and then you've dealt with them. Like, look, see, we stamped out this fire when the fire should never have been allowed to happen in the first place. That's kind of my take on that bit. Yes, it's been very expensive, but I think the idea that we'd be somehow better off with it is crazy. I mean, you could have allocated the money more intelligently, I guess. Matt Hancock said the system has been built from nothing a year ago. Again, other countries had to do this as well. You were not the only country that built a system from scratch. Other countries did this, and yet they did it far better than us. So if you watch this clip here, gotta credit Grant Shapps because he's got the best camera quality and audio out of any of the MPs I've seen so far. It's pretty embarrassing how bad other MPs and ministers' setups are, given that they've been given 10 grand each to help them with their online stuff.
I think that report finding just defies logic. Ask yourself this: had they have not contacted 9.1 million people, told them that they'd been potentially exposed and asked them to quarantine or self-isolate, where would we have been without it? Just yesterday alone, for example, there are over 1.5 million tests that took place, including of all those school children going back, including my children going back to school. Again, if you weren't testing people, you wouldn't know what was going on. So yes, it's been very expensive. The coronavirus has been enormously expensive to society.
All right, that's enough of that. So he's saying 9.1 million people have been tested, right? So if you look at this, it's cost about 40 grand per person to be tested and contact traced. 40 grand for each one. That's a ridiculous amount. Pretty crazy stuff, right? So what is again, Serco Test and Trace, and we'll be looking at that again towards the end of this piece. The cross-party group of MPs was looking at spending on all elements of the Test and Trace system, which despite its name is run separately from the health service. So why do you keep calling it NHS Test and Trace then? I don't understand. This amounts to 22 billion in 2020-2021 and another 15 billion in 2021-2022. So not all of the money has been allocated yet, but the bulk is going on the lab-based PCR testing system, which includes the hundreds of local testing centres and a network of mega labs across the UK to process units. So concerned about the contracts, the committee acknowledges significant investment was needed to set up the system at speed after the pandemic struck. That's what happens when you miss 5 COBRA meetings. But it criticised the overuse of consultants, saying it needed to wean itself off its persistent reliance on consultants, which were costing an average of £1,100 a day, and some of whom have been paid more than £6,600 a day. The issue here is that what advice are these people giving, given the fact that the contact tracing system is nowhere near as effective as it needs to be? So what are they saying? Oh, your system's bad, it needs to work better, here's £6,000, thank you. Is that what's going on? Shapps was asked why expensive consultants are still being used at a time when the government said only a 1% pay rise for NHS was all it could afford. He said he did not know the detail but defended the complexities of the job. Again, it's a cop-out. He didn't know the details. Like, who does know the details then? Absolute idiot. So we go here, apply for a test kit. So you got a home kit collected by Amazon Royal Mail, which is, is fine. Supplied an analysis by Randox, who gave test kits that were deemed unsafe. Facility set up by Deloitte. I think they deal with bankruptcies and other things like that. Testers provided by Sodexo, Boots, Ministry of Defence, managed by G4S, a security firm, Sodexo and Ministry of Defence. Like, the amount of private companies within this chain are ridiculous, and we haven't even gotten through all of them yet. Test kit registration and appointment set up by Deloitte. Attend a test centre. Data's past the NHS. This is the only time the NHS is actually really mentioned in this flow. So facility set up by Deloitte, all that stuff. Completed tests delivered to Lighthouse Labs by DHL, who obviously deal with transport. Again, I have no problem with Amazon, Royal Mail and DHL being involved in this, because these are companies that actually do this job of transporting goods or items. So Tesco Labs, run by Perkin Elmer, AstraZeneca, GSK, University of Cambridge, University of Glasgow, UK Biocentre, Randox Medicines, Discovery Catapult. Is this a subsidiary or something? Contact tracers employed by Serco, complex cases traced by local councils and Public Health England, call centres run by Citel. So you can see the amount of private companies involved in this, and the NHS doesn't really do a lot when it comes to test and trace. So the question I ask you is, why is it called NHS Test and Trace? So, how performance has struggled. The committee pointed out that while capacity has grown, the system has still never met its target for to turn around all tests in a face-to-face setting in 24 hours. It was found lacking in the crucial point in September when there was a surge in demand for testing. By contrast, contact tracers have been underused, with just half of the time spent working on cases in October. So the question you got to ask yourself is, where is the money going that was given to Serco to run these these tracers, these trace centers? Where is that money going if these people aren't, if they're not even being used properly? It's just ridiculous. Here we've got another one. So person tests positive for coronavirus or shows symptoms. Infected person interviewed by contact tracer to find out who they've been physically close to. So low risk contact, no need to self-isolate. Close contact, a face-to-face contact, or someone you have spent more than 15 minutes in close proximity to. High-risk contact, asked to isolate for 14 days. Contacts are then monitored daily or less frequently. If symptoms develop, contact tested and treated. No symptoms after 14 days. Contact given all clear. So by January, contact tracers have been in touch with 2.5 million people testing positive, and advised them more than 4.5 million of their close contacts to self-isolate. So it's a bit weird. Grant Shapps pulled out a lower number, but whatever. But it warned compliance with self-isolation seems to be low. That's something that Serco and these other companies can't actually control. It also raised concerns about the use of rapid on-the-spot tests. Pilots in Liverpool did not show clear evidence of a reduction of infection in hospital cases. Labour's Rachel Reeves said the report showed the system had failed the British people and underlined the epic amounts of waste and incompetence. Dr. Billy Palmer of the Nuffield Trust think tank added, the promise of a world-beating test and trace system has just not materialised, and the eye-watering sums of public money poured into the system are set to increase even further. He said, despite the rollout of the vaccination programme, it would remain an important tool, and urged ministers to do more to financially support people to self-isolate. And that's another problem there. Some people with symptoms may not go for a test because the amount of money you're given to self-isolate just isn't enough. So if we actually look at how much this thing costs in relation to the NHS, in terms of they could afford 37 billion for this Serco test and trace system, but couldn't afford a pay rise for the NHS. So if we actually look at this, so you got 1.3 million staff who work for the NHS, right? So that 37 billion that they've spent on test and trace is about 28 grand each, right? But say it would be fair to them, right? Say, for example, if you save that 10 billion because you didn't waste it on Serco Test and Trace, right? You could have given £7,692 pounds each to each member of the NHS staff, and obviously you would look at how each person's paid, etc. But you could have given this amount had you actually stopped, and not wasted that much money on the Serco Test and Trace system. So if we actually look at this, you could have given NHS staff, £147 pay rise per week each. That's how much you could have given them if you didn't waste all of this money on the test and trace system. And that's generous. I think £27 billion, given how much they've wasted on consultants. Some of these people getting paid £6,000 a day, but you don't have money for, NHS staff, really? Seems a bit sus to me. Anyways, I'm going to leave it there. Let me know what you think in the comments below. Like, comment, share, subscribe, and hopefully I'll see you in the next one.